Appreciate everyone for joining live. If you have a cat with constipation, please let us know in the comments if this topic pertains to you. I'm guessing that you're here for a reason, but welcome. For everyone new here, welcome. If you're returning, welcome back. I'm Dr. Katie Woodley, the Natural Pet Doctor. I'm a holistic integrative veterinarian, the founder of the Natural Pet Doctor. And gut health is one of the passions of mine. Unfortunately, years ago, went down the path of autoimmune disease, ulcerative colitis with my husband that led me to this beautiful journey of realizing that there's a different way to approach the body. And so even though it seemed like a curse at first, it was truly a blessing and led me to a path of helping pets in a much different way. Now, I'm really excited to bring back a guest that we've had in the past, Dr. Betsy Redmond with Innovative Pet Labs, because I'm so excited about the mission that they're on and also the testing that they're offering my patients, my pets, and it's changing the world of pet care essentially because it's allowing us to find root causes, gaps where we can know what we're treating, how we can figure out like why isn't this not helping my pet? Like if they're on all these medications, maybe they're on prescription diets and you're like banging your head against the wall and you're like, why is nothing working? So I want to do a brief introduction first though, because Dr. Betsy is a pretty amazing lady. And so I just wanted to showcase a little bit if you're new here of all the amazing things she's done and some of the like her passions too, because that's always fun. So Dr. Redmond has worked in a clinical laboratory education and research for almost 20 years. She holds a master's of medical science, MMSC from Emory University, a PhD in nutrition from the University of Georgia, and she's an active member of the American Academy of Veterinary Nutrition. So as the co-founder of Innovative Pet Lab, Betsy's goal is to provide easy-to-use testing that gives pet parents a deeper understanding of their pet's overall health and actionable steps. That's key. Dr. Redmond lives in Atlanta and enjoys spending time with her husband, 3 kids, and 2 dogs, Ollie and Linda. She also enjoys running and can never get enough of researching the right answer, which I absolutely love. So Dr. Betsy, thanks for having me here, being here, also doing another amazing live together to kind of share, this amazing resource, but also cover cat constipation because so many cats are experiencing this health problem. And, it's one of those things where I know a lot of cats that start experiencing constipation end up going back and forth to the vet. And a lot of times the disease progresses. And doctors, our audio is completely off. Can everyone else hear us on Instagram?
Yeah, I was trying to see. Oh,
Anyone else? Bad echo. Let me see here.
I've turned my volume all the way down.
Are you guys still hearing echo when I talk? Okay, so if people are leaving because of the echo, here's where you can go. Betsy, do you want to stay on StreamYard and do that? Or
yeah,
do you
that
want to?
sounds good.
Okay, so where we're at, if you go to Dr. Katie Woodley, the Natural Pet Doctor YouTube channel, you will see us live there and the replay is there also. So if you go to also our Facebook pages, so YouTube and Facebook, you guys can see us there, okay? And then that will be recorded and we will share this with our community. So let me just type that in really quick. And then that way it's not going to be so annoying for people. So, all right. Okay. I'm going to end this and then we'll stay on StreamYard.
Okay.
Okay.
Bye Instagram.
Bye Instagram. I don't know if they could hear it, but it is what it is. So, all right. Perfect. I see some people joining us over on like Facebook and YouTube. So that's fantastic.
Okay, good. Yeah.
So it's all recorded. So everyone, we will repost this and share it.
Right. We'll take the interesting bits and put it on Instagram.
Exactly. So once again, thanks for being here, Dr. Betsy. Thanks for having me also. I wanted to kickstart the talk today with a little bit about what exactly is constipation in cats, because this can be a little bit confusing. And when we're talking about constipation, it's important to know what to look for in your cats and what symptoms they're displaying. So constipation means literally your cat is having problem pooping. They're having a problem with defecating. Our cats should be pooping once a day at least. And if they're going longer than 48 hours, we have a problem. Now, I know a lot of like my clients and patients, they'll switch over to a raw food diet. And this is a normal change to your cat's stools. It gets smaller, it gets harder, but they should still be pooping once a day and they shouldn't be straining. And a lot of times the poop doesn't smell, which is great. But those are important, key, normal changes when you change from especially a kibble diet to a raw food diet. But if you're noticing straining in the litter box, a lot of times if they're getting backed up, they're not able to defecate, they'll start vomiting, they'll go off of their food, they start becoming more lethargic, they start acting different, and they might start separating themselves from like their normal behaviors. Like if they hang out with the family, they might start isolating in separate rooms and things like that. So if you're noticing those changes or seeing those behaviors, you definitely need to get them checked out by a veterinarian, have a physical examination. A lot of times they're going to want to do x-rays. I highly recommend it. We need to know what's going on internally to get a better idea. Now, the problem with cat constipation is that there's a lot of causes, but I wanted to touch on a little bit about like the journey of a constipated cat, because what can happen is if they're not pooping frequently enough, it starts getting backed up more and more. And if we don't deal with the underlying cause of the cat constipation, this problem can get worse. And what can happen is when we get to end stage constipation, it's actually called obstipation, where they can't poop at all, and even megacolon. Megacolon is what we definitely do not want to happen, because the colon will become distended with stool and it's dilated. So it becomes like this flaccid colon that can't contract down. And that's end stage disease. A lot of times these cats need to have surgery to remove their colon, which is not ideal. So we want to make sure we're doing all the things that we can to identify what are the causes of this, because constipation doesn't just show up. There's always a reason for this symptom. This is a symptom. It is not like it's a diagnosis, yes, but it is not the reason for why constipation happens. And so we need to be thinking about, is this a litter box issue? Have we changed the litter? Do we have enough litter boxes? Is this something where they don't have enough physical activity? I want you to think about like yourself. Like, I know it's lunchtime, so I apologize. Like, we're talking about gut health and like cat poop, right? So, but think about yourself. Like, do you feel better when you're physically active? Are you more regular with like your bowel behaviors and habits, right? I know, like personally, too much TMI, right? But if I'm exercising and I go for a run and I'm moving daily, my bowel habits are much better than if I'm lounging around and not moving. Physical activity and exercise is really important also for our cats. So these are areas I want you to be thinking about if your cat is experiencing these symptoms, but also too, think about these areas so we can prevent this from happening, because it is a very common condition. The other thing too is dehydration. So this can come from medical illnesses, things like chronic kidney disease, which is very common, diabetes, a species inappropriate diet. So for feeding cats a dry food diet like kibble, that can be more dehydrating to them than a food that's like 75% water content, like a canned food diet or a raw food diet. So things to be thinking about, right? Is the nutrition right? What does the environment look like? What is their physical activity? Also looking at stress, the emotional health. So are we stressed, or have we created like a little like peaceful sanctuary for our cats where they have a quiet, safe space that they can go to? These are very, very important, because that gut brain axis, any type of stress will directly impact the gut and can affect the motility of the gut, can affect the microbiome and other things that we're going to talk about today. And then finally, do we have a gut health issue? This can stem from all the other things I just mentioned, but like, is the microbiome, so the good bacteria versus bad bacteria? Do we have dysbiosis? Do we have an inflamed gut lining that's leading to an intestinal permeability issue? Do we have a problem with the immune system that's in that local gut? Is the IgA okay? We're going to talk about all this stuff, so don't worry if you're like, how the heck do I know if this is going on? This is the key, and this is a newer area in vet medicine, which is super exciting that we have some of these tests to help identify these areas that you can improve, rather than hoping that the supplements or the prescription diet that you're using are actually doing what we need them to do. So with that in place, so thinking about all those reasons, right? We have to address all those areas and be thinking about them, especially when it relates to cat constipation. I want to talk about some of the testing. So I mentioned x-rays, right? Your veterinarian's going to recommend an x-ray, an abdominal x-ray or radiograph, same thing. We need to see what the colon looks like. We need to see if it's distended with stool. We need to see, is there like a mass or something pressing on that colon? It'll give us, do we have any osteoarthritis along the spine? We know through studies that that can create an issue because it can affect the nerve function, the innervation to the gut. So that x-ray is really, really important. The blood work your vet should recommend too. So basic CBC, biochemistry, looking for any external like diseases, kidney disease, thyroid disease, diabetes that could be creating these issues too, are important. Those would be what I would call your baselines. We need to rule out those, and every single conventional veterinarian can do those tests. So this is like your basic baseline. But now we have the ability to look a little bit deeper and see, are other things off in our cats, and especially their cat, like the cat gut health, so that way we can make sure we're not missing something. Because if we miss something and we get years down the road, we have all these years of disease and inflammation to reverse. So this is where I would love for Dr. Betsy to talk about some of these tests that Innovative Pet Lab has come out that you, as the cat parent or pet parent, these also, there's dog testing too, you can actually do yourself at home to get a better idea of what's going on in your cat's gut. So Betsy, will you talk about some of the tests that you have for cats that are going to help illuminate if we have an underlying issue?
We have 4 tests for cats. It comes in 2 pairs. But I think you made a lot of great points, and besides just the exercise and stuff, I think of that if your cat maybe can't tell you like, I'm really constipated and I'm uncomfortable.
Yes.
So
I know a lot of them will go and like lay and just sleep. So what do cats do most of the time anyways? Like if you just let them be and you're not engaging with them or getting them active, most of them will sleep, even if they're sick. If they're healthy, they sleep. If they're sick, they sleep. So, it's always good to make sure that we're checking that litter box daily and we're looking for stool. I have 3 cats, so sometimes it can be hard to identify, which one's doing what, but I should see close to 3 stools, a day. So different stools. And I've gotten really good at knowing, this is this cat, this is that cat. They look a little bit different. They're all quite small because they're on a raw food diet. But it's really important that we're watching that litter box for that very reason, because a healthy cat can sleep and a sick cat will sleep. So
right. So it's hard to tell. Yeah, and the baseline markers, I think that those generally, I mean, are you looking more for like a diagnosis? Like, is there, something that's already gone wrong? So
yeah.
I think our tests are great with those baseline. We think of doing them along with them, but they're not going to be diagnostic of a disease because they find it so much earlier.
Yes.
So we have the inflammation and immunity, and it'll look at 2 markers: calprotectant, which is a marker of inflammation right at the gut lining. So it doesn't really look at whole body inflammation. It looks at inflammation at the gut lining. It's neutrophil, which are white blood cells, infiltration to the gut lining. So it's real focused on what's happening there. And it'll identify if your cat has GI inflammation and the level of that inflammation. But the good part is there are things you can do to bring it down. And with most, holistic vets, you're going to get changes in diet or supplements or things that are going to bring it down. And we see that happen all the time. So it doesn't always have to start with steroids or antibiotics. You can kind of make the environment right, and then the inflammation will come down. I mean, in some cats, it's going to be super high and you need to address it another way. For most cats, you're going to find out that if they have inflammation and to the level of that inflammation, and then decide the next steps with that.
Yeah. And I love what you said too, just before that. Like this is a proactive approach too. So like I know a lot of like pet parents in our communities are really excited about what can we do to prevent diseases. And this is something where, and I see it every day, and I talk to pet parents every day that say like, they were fine like yesterday, and then the next day they were diagnosed with, cancer, or they stopped, in this example, their cat's constipated. Whereas before they were fine. And then all of a sudden this week, like now they haven't pooped. And whereas before they were pooping once a day. So this is what's nice about functional medicine testing is we don't need to wait. We don't need to take that reactive approach to medicine to wait for an issue or wait for a diagnosis to be able to take action. This is where we can do this test and see and get a good baseline. How is our cat's gut doing? And if it looks great, fantastic. What we are doing is not creating an issue at this point in time. And it can give you a sense of relief and a sense of peace too. Because I know there's a lot of worry. We're always reading about like pets getting sick, and you're seeing on like Facebook groups, like, all these animals are so sick and you're like, I don't want my cat to be like that. But what do I do? This is where the proactive testing is really, really helpful to identify that. And for example, our Moki cat, our cerebellar hypoplasia cat, we did one of the IPL tests, and he actually came back and he was doing fine. He started off with gut health issues a few years back when we got him, and he had multiple rounds of antibiotics. He was vaccinated early. He has cerebellar hypoplasia. He was a rescue kitten that we got. He was neutered, as soon as they got him and as soon as they were able to. And he had, levels of inflammation in his gut. So doing that, I was like, oh, I need to up my game with my supplements that I can use for him so he can heal and we can keep him that way. So I'm not waiting for him to develop like something like inflammatory bowel disease or constipation issues or things like that. So that's definitely, I wanted to bring that back. Like these tests are really helpful, proactive. And the calprotectin too is such a great marker. And it's very common in the human side, right? Like that they're testing that, especially with like,
it can help differentiate, like it'll help it's not like the one marker, but it helps differentiate. Do people have inflammatory bowel disease or irritable bowel syndrome, which are going to be totally different as far as how you're going to treat them and what they are. So if it's really low, it's unlikely to be inflammatory bowel disease. It's more likely IBS, a syndrome, and you can look for different things and maybe not be as worried about other downstream damage. So
yep.
The same with cats.
Yep, definitely. So for cats, for example, so like the IBS versus IBD. So IBS, if we're not seeing that calprotectin elevated with a cat, we need to really be focusing on that emotional health, right? Looking at, is there a lot of stress in the household? Are there things that we can do to like calm down that sympathetic nervous system, that fight or flight response, and calm those things down? And like, Dr. Betsy mentioned, there's so many supplements that we can use. It doesn't mean you use all of them, but this is where, partnering with a holistic veterinarian, there's a lot of great free information. We have a lot of great free information. I know you provide information too with the test results also detailing like what to do based on those results. So that way you can start with one thing and, cats are cats. So we don't want to like put the whole like everything in and then they go off their food. We have to start slow a lot of times with cats so we don't put them off their food. But this is really, really helpful to identify, okay, do we have an inflamed gut lining? Because then there's also the other part of that test, that inflammation immunity test. And what does that look like and how would we apply that to our cats?
Yeah, so it's secretory IgA. So I'm thinking of the gut. I'm always got my diagrams going. So talk with my hands. Like think of the gut lining and then the mucus layer and then the stool. But that on the gut lining, the first line of defense is secretory IgA. So you have a lot of IgAs. Their immunoglobulin is like you can have immunoglobulin A, immunoglobulin G or E, but IgA is your first defense at the gut lining. It's on mucous membranes like the gut, and it's going to react to things. So it's out there kind of on guard, and it can react to some of the big ones are parasites, pathogens, to food reactions. So if it's really high, it may be that that may be a good thing. It may be that it's reacting to something, but you don't want it to stay high because then it can lead to more issues. It also gives you some idea of what's going on in that gut lining. So how are those activities going? And then if we see it really low, it's kind of like, well, is it not there to help really support? And do you need to support more immune system support, more gut lining support?
Yeah. And I think too, it's really fascinating seeing like these test results come in and seeing what a lot of these cats are going through. And with constipation, like, is there a reaction to something? Maybe there is a food sensitivity. that the cat's overreacting to it. If we can remove that and calm things down, I mean, there's never a guarantee, right, that we're going to clear up the constipation. But if we have an imbalance or something that's like really irritating that gut and that microbiome is overreacting, like we need to be aware of that, because it's going to be a piece to the puzzle of getting these cats back to balance. And it doesn't, this is the thing, I'm going to say it diet matters tremendously, but diet is not everything, right? Like food is the foundation, food is medicine. If you've heard me talk before, I mention it all the time, but we have to look at these other parts, because it's not just like the digestion piece. There's the immune system, just like that IgA is really important. And if your cat has a weaker IgA, or that mucus lining is not appropriate, and we don't have the right ecosystem, and it can't inactivate those toxins or bacteria that cat is being exposed to, it's going to have a really hard time and a struggle to even digest that food. So I can tell you, for every cat parent here, if you're feeding a prescription diet, you need to make sure that they're digesting that food appropriately, right? Because it's not the cheapest food on the planet. But we also need to be wondering, like, why does this cat need a prescription food? Do they truly need it? Is it actually helping them? And this is where, measuring before you go on a prescription food, measuring after they go off a prescription food can also give you an indicator of, like, are they doing better with it or without it? And it can be a scary area. I know prescription diets are definitely one of those like hot topic areas. And I see, comments, Carolyn mentioning, feeding prescription diets, and cats can't come off of them once they're on them. Here's the thing. Those diets were meant for short term. They were never meant for long term. So we need to be doing some of these functional medicine testing. We need to be looking at the body as a whole and these other factors that play a part. Do we have inflammation that needs to be reduced? Do we need to support that immune system? And then also, too, is this cat reacting to things like your other tests measure, right? So, that's another key thing. So if your cat's on a kibble diet, this next test is for you, all of you listening.
So we look at zonulin and antigliadin. So it's leaky gut or intestinal permeability. So your gut lining should be, it should be permeable, because you have to have nutrients come in and water, things coming in and out, but you don't want it too permeable and unguarded, so things are just coming in. So if you have an increased permeability, then there's a marker zonulin that can increase and identify that there is increased permeability. And so that kind of puts them, your gut at risk of being more reactive to certain foods, because maybe something's coming in that, you might not let in on your own if the gut lining was working better. So you might react to that. So generally, like if the zonulin is elevated, make sure there's not elevated because of the calprotectant, like it's not inflammation, but maybe it's food reaction. We also have an antigliadin antibody, just to kind of see, is there a reaction to gluten? So it's not a marker of celiac disease or gluten allergy. It's just an immune reaction. So it doesn't mean that they're forever going to have it, but it does mean at that point they're having an immune reaction to it. And it may be a good idea to pull it out while you're trying to heal the gut.
Yeah. And this is so helpful, because I remember, I think it was back in December, where we went through some of those case reports with the shelter cats that you had done the gut health testing on with these tests. And a lot of those shelter cats, of course, are going to be on a dry food diet, a kibble diet, it's one of the cheapest options. So it makes sense. And there is a time and a place, right? Like, I'm not here to say they should be feeding all these cats raw. Great if they can. But here's the thing. When when you tested those cats, we saw a lot of these markers of inflammation and leaky gut. And is it because and also too, anti-gliadin A was elevated. And so if you have a cat that's coming from a shelter or a rescue situation, I've had 3 cats now, testing them. And if you're going to continue that kibble diet, make sure they're not reacting to the gluten that's in that food. And if they are, move them to a different type of food. So that way, once again, you're not waiting and hoping that everything's okay because we're not seeing outward symptoms. But imagine, like, especially if we have a cat with constipation issues and that digestion is not moving, that motility is very slow. And if we have this cat processing this food very slowly, and they're having these reactions to it. Even if like the zonulin's not elevated or calprotectin's not elevated, I imagine like over time, if we're having this reaction, we're very likely to lead to something like that. I can't say it causes it, right? But if we're having things that are not being processed, they're just backing up, there's going to be toxins. It could be fermentation. We could have overgrowth of bad bacteria, that dysbiosis imbalance. This is going to impact your cat's gut health, and it's going to potentially make that constipation worse, and it's going to make them not feel good. A lot of these constipated cats get gassy, and you see things like that, and they'll get intermittent diarrhea too when they pass that stool. So we want to make sure that that gut lining, that immune system, that they're not reacting to the food that we're feeding them, because those are things that we can change for them. That is the key part of this conversation, is that we can test, we can identify, we can make sure that that is not contributing to the health problem that we have with our cats with constipation. And then we can do something about it because we know about it. So we're not guessing and hoping that the things we're doing are working, right? So I think, these tests are really, really helpful for that. I'm going to put a link up for the cat gut health test as we talk more. So you can go to Innovative Pet Lab if you're wondering where to get these. The nice thing about this is they're stool tests. So you can actually order them yourself directly from Innovative Pet Lab. The test kit comes to you as the pet parent. You collect the stool sample, you put it in the test kit, super easy to do. And their instructions are
you can
very
have
easy.
some litter on it. It doesn't have to be all, you don't have to try to catch it and not get litter.
Oh yeah, I
Yeah,
never catch it from my cats.
center.
A little different than dogs, but
Yeah.
that's good to know. So, and you send it right back to them, and in a couple weeks time, you get a detailed report from Innovative Pet Lab that if something's off, they also give you recommendations too. So it's a super easy test to do. You don't have to have like a vet prescribe this test, which is really nice. So you can do this as a proactive like cat parent or dog parent. If you have both in your house, they do have dog testing too. That way you can get a better idea of what's going on.
You can do it as a baseline. So if everything's good, it just kind of tells you whatever you're doing is working well.
Yeah.
So
So, that's the thing. Start there. Start with that baseline testing with your veterinarian. Make sure they're getting checked out. Now, here's the thing. I wanted to make sure we had some tips and tools for other than the testing for cat parents that are going through some constipation issues. This is where we want more moisture in the body. So if you are feeding a kibble diet, even if you're feeding a prescription diet, see if you can get your cat onto a prescription wet food. It will be better than the dry food. The wet food will be much better. So a lot of these cats will go on things like a higher fiber diet, which fiber can make a huge difference for these cats. If you're already feeding a raw food diet and maybe they're getting constipated from that change and you're not seeing stool being produced once a day and it's going 2-3 days, add in psyllium husk into that food. We still need fiber. Cats still need fiber too, because when you think about it, if they were going outside and hunting, a lot of times they're going to eat that fur. That fur is acting as that fiber. And so we want to provide a source of that with whatever food we're feeding them, especially for cats with constipation. A lot of people will use your canned pumpkin. That can work for some cats. It's worth trying. It's very safe, but we want to manipulate that fiber content. And there's going to be different types of fiber too. So you may have to play around with soluble forms or insoluble forms of fiber also, because each cat will respond differently. And once again, the microbiome, the immune system, the level of inflammation will also affect the way that your cat is digesting and what stool is being produced at the end of that. The other things too, some simple remedies that most pet parents can access are things like slippery elm to help like soothe and calm down inflammation, but also kind of get some lubrication. Things like coconut oil can also be really helpful too to help get that stool out. If you have access to an acupuncturist, I love acupuncture on my cat patients, especially when they're constipated. It helps reduce inflammation. It stimulates those nerves also. So we have those nerves coming down from the spine that are innervating that gut. And that's a big problem, especially if we have older cats that have osteoarthritis or degeneration in their spine. We might have some decreased innervation. Those nerves aren't speaking as well to the gut as they should be, and the gut is moving slower, or it's just not, that motility is off. So that acupuncture can help open up those pathways, nicely stimulate those nerves. And a lot of cats feel really good because it's also releasing natural endorphins and opioids that gives them a calming sensation. It's just amazing. A lot of cats will go to sleep. They feel better after I just love doing acupuncture on cats. Cats are energetic beings and they feel really, really good. So definitely, if you can access that service, I highly recommend it. I do a lot of Chinese herbal formulas. You want to work with an herbal practitioner that's trained in that. But there's a lot of formulas that are out there. So depending on your cat's pattern, we can figure out like what's going to work best for helping them. But once again, going back to the symptoms and the causes that we talked about at the very beginning, make sure you're addressing those pillars. We're addressing physical health and their activity levels, the emotional health and their stress levels. We're addressing gut health, making sure we're doing the testing that we now have access to make sure that there's not little gaps or holes that we need to fill in, and just assuming like what we're using is going to make like a difference for them, and in reality maybe that prescription food could potentially be creating some harm for them. I know I want to know, and sometimes it works really well for that prescription food for that cat, and I'm not saying to change that diet necessarily, but also too, if we have other things that are off, maybe we need to adjust it with some supplements, other nutraceuticals, other holistic modalities that we can use to complement that treatment for them. So those are a couple of things to think about. I know I found a study too with like the microbiome responses also in terms of different species of probiotics that can help manipulate the motility of the gut with that microbiome. So it may be worth trying some of these things like, spore-based probiotic or soil-based probiotics. Your lactobacillus strains can also be helpful too, based on that study. Play around with what works for your cat. Keep a journal. Make sure you're monitoring that litter box and make sure you're doing the testing, or otherwise we can end up like over supplementing our cats or wasting a lot of money on things that may not even be needed or may not be working for our cats too. So those are a couple suggestions. I don't know if Betsy, you have some recommendations or more on like the testing side of things to help cat parents.
Yeah, no, I mean, I think that, we think of testing at baseline just to know if things are okay and to have a baseline. So if you test again, it's like, oh, well, last year they didn't have these issues. So at least you have a comparison for your cat.
Yeah.
Unfortunately, there's just not as much research on cats as there is on dogs.
Yeah.
So you will have to kind of keep track of what is happening for your pet. You can test and know what they're doing. You can retest and know how you changed. And then also looking at look at your litter box, like keep track of those things. Someone's asking about the different probiotics, but I think the soil-based ones, like you mentioned, and then getting, brands that are specific for pets are good good place to start, like Vetline, like Standard Process or Therapet.
Yeah.
And really following them, because there isn't a whole lot. When we did our study on cat stuff, and we included those shelter cats just to kind of see, like we just went to the shelter, and a lot of them had been sick. They found them on the street, and they were taking I think of it like, good public health care. So
Yeah.
just like they had kibble because they can't afford to, they want to get as many cats, and they gave them all their shots and everything. So that was, good public health care, but it may not be exactly what that cat needed right then. So we did get a lot of those cats had a lot of gut issues,
Hmm.
so.
Yeah, definitely. And I think too, like touching on, the probiotics, it's important to look at the other ingredients that are in a probiotic.
Mhm.
That's like, what are the fillers? What are the flavorings? There's going to be a lot of things that come with that. And we did a recent YouTube video on like, is your pet food toxic? And we're talking about some of like the ingredient list and what it actually means, and like the rendering process. And some of these common, well-known probiotic supplements are going to have things like titanium dioxide, which is a known carcinogen. And then also too, some of them will have things like animal digest, which is actually a rendered product to increase the flavor of the food. And once you start learning about what does that mean, you want to be asking like, okay, I see this like enterococcus. Okay, there's a lot of, studies that are done on that strain of bacteria. It seems really helpful, but what is this company combining it with? So always read those ingredient lists, because the thing is you could be using a really good strain of probiotics that has a lot of testing, but the other things are like offsetting the benefits. And it could potentially be leading to things like inflammation, or putting poor quality ingredients into our cats. And it's, if we're going to spend money on something, I want to make sure like it's doing what it needs to, that's coming from organic, grass-fed sources if possible. Like these animals are being raised on the foods that they're supposed to be eating. So it's going to decrease the amount of inflammation potentially that we're going to be, we don't want to be creating more inflammation or putting more stress on that body. So keep that in mind whenever you're assessing supplements or you're hearing someone promoting a product. Start asking those questions about like, where was this sourced? How was it tested? Does it come from a human grade facility? Like supplements are not regulated at all, like at all. It's kind of scary. I mean, it's just as scary as the
Well, and
pet
I
food
think less so
industry.
in the
So
pet world, like the people world, that you're going to get a lot more headlines if something happens. But in the pet world, it takes a lot. I think that they had that pet food from China. Was it? They put that
the
melamine or
the melamine
yeah,
incident, which killed like, tens of thousands of animals and harmed so many more. And it's like, it you don't hear about it until animals have died. That's
right.
the thing.
Until it's
Like
been a
it's too
lot of
late.
them.
It
Yeah,
is way too late. And the harm has been done. And think about if you're giving a supplement or a food every single day, and we're talking about gut health and like constipation, think about that buildup of those potential toxins, the buildup of the inflammation. Like it may not lead to disease tomorrow, but if we continue to give that, and then we start adding in like the environmental toxins and the emotional stress, like our poor kitties' bodies are dealing with so much. And that's where they lead to that breaking point. And that's essentially where, like, yesterday they were normal. Today, all of a sudden, we're diagnosing a health condition like, constipation. And you're like, what happened? And it's that spectrum of disease that we are all on, where we are really healthy. Our bodies are working really well down here. And down here is essentially death, right? And we're always going to be fluctuating, especially as we're aging. Things are working harder. So we need to be supporting these areas and assessing that and becoming aware. And this is where, like, I love all the people listening to this live and, listening to the replay and wanting to learn more, because we have to empower ourselves to be educated pet parents, to take the proactive approach. Like, yes, use your vet, but make sure you're asking those questions of like, why is this happening? Why does my cat have constipation? Constipation is a symptom. There's a reason why it happened. And there could be multiple reasons, but ask why. If we want to use a medication, like, okay, great. What does it do? Why are we using it? Are there other things that we can use too? Are there side effects? Making sure that we're getting that big picture, because there are a lot of drugs that are used with cat constipation, and some of them are needed for these cats, 100%. Cisapride is like a lifesaver for so many cats to help them with the motility issue. But the thing here is also with medications, I'm not against medications. There is a time and a place where we need to use them to help the quality of life of that animal. And also, too, they work faster. So Dr. Betsy mentioned, if we have really high inflammation, if we have really high calprotectin levels, sometimes we need to use something that's going to bring that down very quickly while we're instituting a holistic integrative treatment plan. Because these supplements and a lot of these herbs and a lot of food changes, those are your foundation and they can take longer to work. So keep that in mind, especially if you're new to like the holistic health journey. Sometimes we do need to use drugs, especially with constipation, to help with things. And then we institute those Chinese herbs, we institute acupuncture, we institute those food changes, we start using the nutraceuticals, and we're journaling, we're tracking it, we're monitoring it, we're doing the functional testing to see how is our cat responding. That is the true holistic integrative approach. Holistic doesn't mean we don't use medicine. So don't feel bad if you have to use medicine for your cat, especially with constipation. Not pooping is a deadly disease. You can't poop, you die, right?
yeah.
Like,
And then I think
so,
same with inflammation. Sometimes you can't heal things if the inflammation's really
yep,
high until you get it down, and
yes,
then you can try to get things. I was
yep,
going to say we also like you can, if there's anything really out of range on your test, you can print it as a PDF and then bring it to your vet or email it to your vet so you guys can discuss what's going on and next steps.
yep. That's another piece to this. What's really nice about this, because I hear this from a lot of pet parents, and it can be really kind of scary as the conventional vet if you're not used to these tests and you get like nervous and you're like, what are my clients doing? And what's so nice about this is like, IPL breaks it down. It is a science-based test. And so you have reference ranges from healthy animals. Your vet can talk with like the team at IPL. They can talk with Dr. Betsy if they need to have explanations or clarifications. It's not, sometimes there's a lot of different testing in the holistic realm, and a lot of vets can be like, this is just woo woo, right? But what's nice about this has been done for years and years on the human health side. Through functional medicine doctors and even regular gastroenterologists. And so now we have the ability to do this with our pets. And so if your vets just hasn't heard of them, introduce them to them, because this is something that they can integrate into their practice to help their other patients. And it makes it more commonplace, which helps all of us, because we all want our pets to be healthy. We all want to be proactive with their health care. We don't want our pets to be sick. It's expensive. Constipation is an expensive disease, a very stressful disease. And, a lot of times these poor kitties have to be, anesthetized, to be, have an enema and, be manually evacuated. It's very stressful for every single person involved. So if we can do things to help prevent it, but also too, to make the management of the disease, if your cat already has constipation, much easier, 100% your vet, I guarantee you, wants to know the tools and have those tools in place too to help your cat. Perfect. I think that is a great roundup of, the summary of where we're at with, I think the big thing here for everyone, if you have questions and, you're not sure where to go, these tests are a great starting place. It is part of my recommendations for literally every single one of my patients I work with, because I want to know what is the status of that gut lining? What is the status of the immune system? What is the status of the inflammation? And it's such an easy test to do, and pet parents can get access to it. So definitely check out Innovative Pet Lab. The other thing is continue to ask those questions. So if you have a cat with constipation, definitely check out the other resources, the other videos that we have to help guide you with some of the other remedies and things that we use to help our cat patients with constipation. And if you have any questions or issues, or you're having trouble navigating that space, feel free to reach out, to me, Dr. Katie Woodley, the natural pet doctor. But if you have questions about these Innovative Pet Lab tests, Betsy, what's the best place for them to reach out to
at
you?
info, just go to our contact information.
Okay, perfect. Yeah. And then your website, I know it's beautifully posted.
innovativepetlab.com.
Okay, perfect. So innovativepetlab.com. And there's a lot of, they have a lot of information and studies too, if you want to learn more, which is fantastic. So those are things that you can share with your veterinarian too, if they're new to this world of microbiome, gut health testing, all those things. I hate saying it's a new thing, but it kind of is in the pet world.
I mean, I think it hasn't become a standard consensus science, but sometimes I like to think of us more as translational. We see the research and we're translating it to care for people, for pets, cats, dogs. And it's not that if the testing were advocating for something dangerous or taking some harmful medication, sure. But this is just it's going to help you target your treatment. You're still going to do your conventional stuff where you need to, but then target your treatment, your diet, good supplements, those kind of things.
Yeah.
So we're just trying to help.
Yeah. I really like not guessing. And I feel like there's been just so much guessing, and then all of a sudden, pets end up on 15 supplements. And I'm like, do we really need all this? Right. So it's a great way to make sure you need to stay on things, because a lot of times you can heal that gut, come off things, and then you just retest down the road. So to make sure that they're still holding steady and doing well. So definitely.
I was going to say a low level of inflammation, or, somnolent or something that's just a low level that might not seem like anything's wrong. But if you can catch it when it's in that low borderline area, then you can, kind of make improvements so you don't ever go on to be higher.
Yes, definitely. Once you get proactive, we don't want to react, because reacting is not fun. I mean, that's what led me to holistic medicine in the first place. And it was a long journey. So I can tell you from personal experience, the proactive approach is much easier, and it is less expensive and less stressful too. So I'm so grateful that we have these tests. There is a code you can use right now, Natural Pet 25, for 25% off if you do want to give those tests a try. If you do try them, please reach out to me and let me know what you find out and like what your cat is showing, because I always love hearing about what's going on in your pets' lives and their health and how you're helping them. And I appreciate you, Dr. Betsy, and the whole team at Innovative Pet Lab. They're just an amazing bunch of people that have come together to really help empower pet parents and give them more tools to really be proactive about your pet's gut health and make sure that they're on the right path. So thank you so much again for having me. I know it's a mutual thing, but on both of our platforms, we'll be reposting some of these clips on our Instagram. So sorry if anyone jumped over from Instagram and the echo that was over there.
Yeah, someday there'll be you just press a button.
I know, like if it could just stream to all the platforms.
Somebody invent that.
Come on, Meta. Like if you're listening, I don't think you listen to my channel, but make it easier for us to share the information with the people.
Say it in your iPhone.
Yeah, exactly. Sure, it's listening. So, but once again, I appreciate every single pet parent here who is joining us live, taking time out of their day or rewatching the replay and is learning, empowering yourself, educating yourself. I appreciate each and every one of you. It's truly like why I love doing this every single day, because we are all part of this big movement to be more proactive and take this like integrative, true holistic approach to our pets' care to better the world, really. Because when our pets are healthy, I know my health is much better. So yeah. Awesome. All right. Well, thanks again, Betsy. Thanks, everyone. We'll see you guys next time.
All right.
Take care.